Hey everyone, it's Crystal here at the AAFE Training Center, and today I'm going to show you a treatment of one of my patients. As you can see, I am starting off with the ultrasound. So we love the AAFE ultrasound. We use it pretty much every day at the training center, and I specifically use it for more high-risk areas to check before I just go ahead and fill them with dermal filler. So as you can see, I did check her chin just to make sure her anatomy is correct, and then I was checking her piriform fossa space. So ideally, their facial artery should be pretty superficial at that point, at the ala of the nose. Meaning if I inject deep down on bone in the piriform space, I should be safe. So I was just making sure that her anatomy lined up with that, which it did. And this makes me feel very safe when I'm injecting. So just an extra little step. It takes 2 to 3 minutes to ensure that the patient is as safe as possible when we are injecting them. So as you can see, I'm starting with the chin. So she the reason why I'm actually doing her chin mostly is to try to balance out her lips. So she was a patient of mine that I saw, I don't know, maybe 3 years ago, and she came to me with migrated lip filler. She wanted her lips done again, and I told her I wanted to dissolve before I started over. So we dissolved everything, and I've slowly been filling her lips here and there. However, I make her wait a good chunk of time in between syringes to ensure she doesn't migrate again. But because of this, she also needed some chin to kind of balance out her whole face. So looking at her profile, you could see that she really needed some chin. So now that you can kind of see her profile, after putting some filler in there, it looks way more balanced and it makes her lips look way more natural because now it's balanced out with the rest of her face. So I'm basically just doing like a little bit of filler everywhere to kind of just give like a softened, enhanced look. So I gave some in the chin. Now I'm going back to the angle of the mandible. So kind of coming to the back of the ramus and then doing like the corner angle of the mandible. All of these injections are deep down in bone. As you can see, I'm making sure I'm doing a good aspiration and waiting some time to make sure I don't get a positive aspiration. And then delivering no more than 0.1 cc of product in any one injection. So I'm just doing a few just to kind of give it like a little extra oomph, nothing crazy. And I did that on both sides to kind of balance it out. Now I'm going in and I'm doing a little bit of cheek filler. So as you can see, she's got kind of a flat appearance to her mid face. So she's got pretty good lateral support of her cheek, but she definitely needed some mid face support. So that's what I'm doing, kind of going in right at the apple or the apex of the cheek and giving her as much volume there as possible just to kind of help contour her face, support her under eye, and just balance out her entire look. These injections are exactly the same as the chin and the angle of the mandible. Deep down on bone, always aspirating, never pushing more than 0.1 of product. And you can see just moving nice and slow, never, slamming too much product in at one time, not pushing it very quickly, just taking time. This is a high G prime product that I'm using. It's one of my favorites, and it looks really nice on most patients, especially a patient like her who's younger, and you can really see the difference from just using a little bit. So I just did a touch on both sides of the cheek, both sides of the angle of the mandible, and then in the chin, just to kind of give her like an overall balanced look. She probably, and I told her this afterwards, she probably could have used another syringe, if not two, kind of everywhere. But we're on a budget over here. So we're doing a little bit at a time. So we were able to do, I think we either did 2 or 3 syringes on her today. And then she'll come back in 2 to 4 weeks and probably get some more. But now I'm just kind of massaging, making sure everything feels good, which everything looks really good. No major bruises or anything from the start, but always molding up to ensure we're lifting the cheekbones, just making sure everything feels nice and smooth and integrated as opposed to lumpy bumpy. So she handled this procedure really well, and it looks really nice and soft and natural. And that is about it. She did a great job. So thank you so much for watching, everyone, and we'll see you in our next one.